This video will go over how to make an IV push medication and also how to deliver an IV push medication through a running IV. So first off, we would want to obtain our MAR and make sure that we have an order for the medication. Also making sure that it is due at this correct time, has not been given yet, and that we have the right patient, and check the dosages as well. So we're going to use our parental drug manual again, and again this might be on a computer or it might be in a binder at your facility, and we're going to flip to the medication that we want to give. So today we're going to give morphine, 5 milligrams. So we're going to flip to morphine. Now with morphine, there's several PDMs. So we want to make sure that we pick the right PDM because there are ones that can be epidural. There can also be, I believe, intranasal or different other ways to give morphine. So we want to make sure we pick the IV route. And this is not a continuous infusion of morphine. It'll just be a one-time dose of morphine. IV push. So we want to make sure that we are qualified as a student nurse to give this medication, so we will review that policy. We can also check to see what classification it is. We know it's an opioid, it's morphine. And we also see it's a high alert medication. So this one we would probably need a double check depending on your facility because it is a narcotic. So we'll read all the administration policy there, and we'll also skip down to make sure that we can give this medication IV push. Some medications you cannot give IV push because it's too potent. It needs to be diluted. And then it can only be given IV intermittent. You would make a piggyback. So for morphine, we're going to give it IV push because the patient is having a lot of pain. We want the medication to be delivered quickly so that they can be relieved of their pain. Also, if it was another medication, say like diamond hydronate or Gravel, if they were having nausea, we'd want to give them symptom relief right away. So that might be why we pick to give IV push. If we know that the patient has had the medication before, they've had no previous reaction, those are also good indications that IV push is an appropriate method to give this medication. So we can give this IV push. Our PDM specifies that. And it tells us a few things about how to administer it. So it says we can administer undiluted or diluted. So it gives us two options. And it tells us what to mix it with and how fast to give it. So those are all really important things to check on our PDM. The other things we'll want to check as well, the potential hazards, so we can also educate our patient, and also so that we're aware of the hazards of the medication we're giving. We'll check the additional notes, and as well we'll also check the compatibility to make sure if there's a running IV that the medication is compatible with the running IV, the primary infusion. So we have checked our PDM over. We will now do our first check. We will grab our medication, probably from the Pyxis. It's a narcotic controlled substance. So we'll get it from the Pyxis or the cart, the narcotic cart. We're going to grab the vial and we're going to compare it to our MAR. So morphine, the name matches. Our dose is for 5 milligrams. Inside this vial is 10 milligrams. So I know I have enough in this vial to get my dosage of 5 milligrams. Maybe I'd have to get more than one vial if the dosage is higher, say 20 milligrams or 15 milligrams. So I would make sure I grab another vial if I needed it at that time. And I can see that this is IV, and it is due now. Other things you can check too is make sure the medication is not expired, and as well that it looks clear, okay, and it's not cracked already. And because we're in the lab, these are already been cracked, okay, and this is a glass ampule. So I've done my first check. I've checked my order. I've checked against my vial. So I'm going to draw up the medication that I require. I'll do my hand hygiene. Okay. And doing my calculation, I know I need 5 milligrams. The concentration is 10 milligrams per ml, and I know that because it's on my vial. There are other concentrations of morphine, so make sure you pay special attention to the concentration. So I know I need 0.5 mLs. So I'm going to banana peel my 1 ml syringe, and this is an appropriate size syringe because it'll give me very accurate titrations. Okay. Now, because this is a ampule, a glass ampule, we're going to use a filtered blunt fill. So this is one that's got a filter inside, so it's going to filter any glass particles that might be inside the morphine. So we've cracked that open. Okay. And we don't need to instill air for an ampule. We're going to pull back. And normally in the clinical setting, you would crack the ampule. So I'm going to pull back. I have 0.5. Okay, and I'm going to pull back a little bit more, and you're going to see why in a minute. So just slightly more than 0.5. Okay. Now I would discard this, but I would want to get a waste, so somebody to waste that with me because it is a narcotic. Okay. So now with the filtered blunt fill, I have pulled back. So if there was any glass particles, it would get stuck inside this little filter. So then that way no glass particles ended up in my syringe, thankfully. Okay. So I would never want to push or inject this medication into anything, because if a glass particle was in there, it's going to get shot out the needle. So what I'm going to do is I'm going to switch now to a regular blunt fill. I'm going to banana peel that back and attach that there, just like that. Okay. And then now we can get the bubbles out. We can tap it. Okay. And we want 0.5 mLs. So now we're basically priming this needle. Since it was a brand new needle full of air, we're going to prime it like that. Okay. And then with this one, we put it in the sharps container. And remember, there's glass particles in there, so we're not injecting it. We're throwing that one out into the sharps container. Okay. So 0.5 mLs. Okay, and then when we review our PDM, administer undiluted or diluted. So it's really hard to give 0.5 mLs over 4 to 5 minutes. So we'd be pushing very small increments, like 0.1 increments. It can be done, but sometimes the ports will hide medication and it'll get stuck in there. So it might be better if we dilute this so we have a bit of a more volume and it's easier for us to push. But it is completely up to you, your discretion. What I'm going to do, because I like really easy math, is it said I can undilute or dilute with 5 mLs. So that means I can pick 5 mLs. I could pick slightly lower if I want. It's completely up to me. So I'm going to pick a 5 ml syringe, and I'm going to pull up 4.5 mLs of sterile water. So swabbing for 30 seconds, dry for 15. And then what I'm going to need is a blunt fill. So I'm just going to grab from my supply here, a blunt fill, banana peel that back. Okay. And because it's a vial, we're going to inject air. Okay, so we've let that dry. So injected, and I'm going to pull back. I said 4.5 mLs. So this one has 0.2 increments, so we're going to go 4.2, and then halfway between those increments should be about 4.5. Well, maybe I'll pull a little bit extra because I see there's a big bubble in there. Scoop and swoop that. Okay, let's get our air out. Really important that you get the air bubbles out so you can have an accurate dosage. Okay, 4.5. So there we go, 4.5 there. Okay, and now we have 2 syringes. So one with my sterile water and also one with our medication of morphine. So now what we're going to end up doing is we're going to end up instilling this syringe into the larger syringe. So we're going to mix the medications. However, before we mix, just like with a mini bag, we're going to do our second check, because if we've made any errors in calculating our dosage, we want to know now before we mix it. Once we mix it, if we've made a mistake, we've got to throw it out and start all over. So this is a good time to check our mistakes. All right, so we're going to grab our vial in hand and we're going to check our physician orders again. Morphine, 5 milligrams. 5 milligrams, perfect, has not been given. It's an IV dosage and it is for the correct patient. Now with syringe in hand, I'm going to look and verify my calculation. 10 milligrams per 1 ml. I need 5 milligrams. That equals 0.5 mLs. And I'm going to visually check my syringe. I do have 0.5 mLs in this syringe, so that is perfect. I will also just double check my PDM, make sure I read it correctly, that it is morphine, and that I am giving it IV push. Okay, and I've checked to make sure that I can mix it sterile water or normal saline. Okay, and I can do either no diluted or diluted. Okay, and I chose to dilute it. Okay, so next what we're going to do is we're going to take off this blunt fill needle. And we're going to pull back our syringe and make a bit of an air window. So you can see there's an air window there. Okay. And now we're going to inject our morphine, our 5 milligrams, 0.5 mLs, right into our larger syringe. There we go, and we can prime that. And now, because we don't want to take any blunt fill needles to our patient's room, what we're going to do is we're going to replace that cap with a blue cap sterilely. And now we just need to affix a label. So reviewing, morphine, 5 milligrams, 0.5 mLs. My dilutant, I chose 4.5 mLs of sterile water as my dilutant. Concentration per ml, you don't really need to figure out. You could if you wanted to, but just like our mini bag, as long as we followed our PDM, we know that we have mixed this safely, so it's not too concentrated. So I can just put my total volume is 5 mLs. And then, of course, date and time, maybe put your patient's initials, maybe their room number. And then lastly, the other thing we want to check is how fast to give this medication. So it says over 4 to 5 minutes in our PDM. So here you'll have to do a bit of a calculation, and there are lots of options of what you can program this at, or what you can calculate it at. So you'll need a calculator probably for sure. So what I chose, because I have 5 mLs to be infused over 4 or 5 minutes. So it's up to you what you pick. If my patient has never received this medication before, I might want to give it slowly. So maybe over 5 minutes. If my patient has had this medication before, I would give it over maybe 4 minutes. Okay. If it doesn't really matter, you could just pick whichever one, which is easier math. So for me, I have 5 mLs. I'm going to give it over 5 minutes. Easy math, 1 ml per 1 minute. So it's very easy. If I want to break that down a little bit farther, I'm going to give 0.5 mLs every 30 seconds. So that's how much I would push. Okay. So there's a lot of variability about how much you are going to push. So as long as you don't push it faster than the PDM says. So we're just going to put our label onto our syringe and just make sure you don't cover up the titrations, because you're going to need to see those titrations when you push your medication. So I'm going to do my hand hygiene, and then of course I would dispose all of my garbage and my sharps into the sharps, and I'm going to take my MAR, my medication, and also I'm going to put on a pair of gloves because I'm going to be touching around their IV site, so risk of bodily fluids. And I'm going to approach my patient's room. Knock, knock, knock. Hello, I have your morphine for you. Is it all right if I come in? And I'm going to come in with my MAR. And I'm just going to grab a flush here as well. And some alcohol swabs. Okay, so because this is a running IV, I'm going to check to make sure with my MD orders that it is the right IV fluid, and also that it's running at the right rate, and that is correct. Okay, I'm also going to do a check of the IV here just to make sure that it's still in situ, it's a good IV. Because this medication is quite concentrated, it can be very harsh on the vein, it can be very harsh on the tissue as well. If it's not in the vein, it can cause tissue damage. So I'm going to make sure that this IV is still in situ. So asking, is this uncomfortable at all? Is there any swelling, any leakage? Am I getting downward occlusion alarms? Everything seems to be okay. It seems to be a good running IV. I'm now going to do my third check. So I'm going to check Parsio-Parsons, and then also one other identifier, either the date of birth or the MRN or FIN number, and compare it to the patient's name band. I can also ask the patient as well, can you state your name for me? Parsio-Parsons, perfect. Can you tell me your date of birth, Parsio? Perfect, thank you very much. That matches my records. So now I'm going to have my syringe in hand, and I'm going to make sure that this is the correct syringe, that I haven't mixed it up with somebody else's syringe. Morphine, perfect, 5 milligrams, 5 milligrams. This medication has not been given yet, and it is due right now, and it is IV, so that is correct, and I've identified the patient correctly. So I have done my checks. Now, Parsio, I'm just going to let you know about morphine. So it's an analgesia for your pain. You might feel a little bit dizzy or nauseous. I'm going to put your call bell next to you so you can call me if you have any concerns or reactions. Do you consent to this medication? course, you'll say, yes, please give me the medication. I'm in pain. So what I'm going to do is I'm going to choose the port closest to the patient. I'm going to swab that port, 30 seconds, dry for 15. Attach that syringe, okay? And you can leave your primary infusion running. That's okay. Now, I wrote on my label, it reminded me how fast I can push this. I don't want to just slam it all in, because then that means they get 5 milligrams of morphine all at once, which could be detrimental to them. So I'm going to kink the tubing, and it says 0.5 mLs every 30 seconds. So looking at my titrations, I'm going to push in 0.5. And then I'm going to pause, unkink the tubing for 30 seconds. Okay, so if I've got a watch on or I can see the clock on the wall, I'm going to watch for 30 seconds. Okay, now kinking the tubing, the pump doesn't really notice it if it's kinked very for a short period of time, and then we unkink it to let the primary infusion flow. I will often let my patient know as well, and their family, that I might be standing here for a little while because this medication is going to go over 5 minutes. All right, and so then I'm going to kink after 30 seconds, push another 0.5, and unkink. Observe for any reactions. Watch the clock for 30 seconds. So we're doing a push-pause technique. Okay, so we're going to push a little bit of medication, pause, push and pause. So we would keep going 0.5 every 30 seconds, so that eventually the whole syringe and medication will go in, and that should be approximately 5 minutes. So if we were giving this for 4 minutes, we would be pushing 1.25 mLs every 1 minute, okay? So it's up to you how you want to calculate it. You can choose a pause time of 1 minute or a pause time of 30 seconds. I chose 30 seconds. You can use a pause time of 20 seconds or 15 seconds. It's completely up to you. You would just have to do the specific calculation. So after 30 seconds, another 0.5. So I think you see where I'm going with this. We would just keep going until the whole medication is in. Now, we need to flush the tubing after. So there's morphine sitting in this line. The primary is still running, but that means this medication is going to be really slow to get into the patient. So what we're going to do is we're going to flush the IV. However, we don't want to flush it quickly, because then that means they're going to get that residual morphine really fast, faster than we want them to get it. Okay. So if we put our port down, we would just make sure that we re-swab it. Okay. And I can use a 3 ml syringe here. 3 mLs is actually perfect because that's about the correct amount that is inside this tubing. 3 mLs from this port all the way to the patient. You could, if you wanted, use a larger syringe. So if you only had 10 mLs, that would be fine. You can just infuse 3 mLs from here and then discard the rest or do a flush with the rest. Okay, so important thing, 3 mLs needs to go slow. So we have to do it the exact same rate that we did the morphine. Okay, so again, 0.5 every 30 seconds. So pushed 0.5, now I'm going to pause for 30 seconds and I'm watching the clock. Okay, and then again, 0.5. I'm pausing, watching the clock until the whole 3 mLs is in. Pause, 30 seconds, and then a push again. Okay, and then we can take that off, and we know that our medication has cleared the line. And then we can just throw out our supplies, and then once we leave the room, we would want to document in our MAR that we have given morphine 5 milligrams. And of course, we would monitor our patient. How are you feeling? How's your pain level? And just continue to follow up.